Feeling restless at night or struggling to get shut-eye? Maybe waking up tired or feeling down in the dumps? I've been there too. Today we're going to take a look at 5-HTP. This powerful supplement is known for boosting serotonin. You know, that happy hormone everyone talks about? So does 5-HTP just boost your mood, or does it have any further benefits? Let's dig in and find out. Stick around to the end where we'll check into any potential risks with long-term use. 5-HTP, also known as 5-hydroxytryptophan, is a natural amino acid and is a precursor to serotonin, a neurotransmitter that's super important for regulating moods. Some cool things 5-HTP might do include lifting your spirits. It may help ease symptoms of depression and anxiety and make you feel more positive. 5-HTP might help your body make melatonin, which helps regulate your sleep and could help with insomnia or sleep troubles. It might help you feel less hungry and support managing your weight by making you feel full. Some studies suggest it could reduce how often you get headaches and how bad they are, especially migraines. Research suggests that 5-HTP may have some benefits for depression, primarily due to its role in serotonin production. Serotonin is a neurotransmitter associated with mood regulation, and low levels have been linked to depression. By increasing serotonin levels, 5-HTP may help alleviate symptoms of depression. However, effects depend on a number of factors, as your brain is a complex symphony of neurotransmitters. If, for example, hormones like dopamine and endorphins are out of balance, then boosting serotonin won't be as effective for depression, so keep this in mind. There was a study in 2020 that compared 5-HTP to fluoxetine, a common antidepressant, for treating a major depressive disorder. The results showed that both 5-HTP and fluoxetine were effective in reducing depressive symptoms, and there wasn't a big difference between the two treatments. You can find all the research links in the description. But remember, 5-HTP might not work for everyone, so its effectiveness can vary person to person. 5-HTP might help some people sleep better. It's believed to boost better sleep by increasing serotonin production, which can be turned into melatonin, a hormone that regulates sleep patterns. By raising serotonin levels, 5-HTP could help improve sleep quality and assist with insomnia or sleep problems. Now let's take a look at some research. In a study from 2018, they looked at how 5-HTP affected sleep quality in healthy adults. The results indicated that those who took it experienced better sleep efficiency and duration compared to those who took a placebo. However, people's responses to 5-HTP can differ, and it might not work for everyone. Also, effectiveness of 5-HTP for sleep could depend on factors like dosage, when you take it, and underlying sleep issues. And remember, boosting melatonin production is just one way to improve sleep quality. It's also important to consider good sleep habits alongside using a supplement like 5-HTP. I'll shortly be going through what I've noticed by taking 5-HTP long term, but let's cover another point first. So, there's not a ton of research on how 5-HTP helps with obsessive compulsive disorder, but some studies suggest it might be helpful because it's involved in making serotonin. There was this one cool study from 2020 that found it worked better when used with an SSRI compared to just an SSRI alone. Here are a few ways that 5-HTP might help with OCD. OCD has been linked with issues with serotonin levels in the brain. 5-HTP is a building block for serotonin, so it might help balance serotonin levels, potentially reducing OCD symptoms. Many people with OCD experience a lot of anxiety due to their obsessions and compulsions. Since serotonin levels affect mood, using 5-HTP could help lessen anxiety linked with OCD. Some people with OCD have found that 5-HTP helps with obsessive thoughts and compulsive behaviors. While more research is needed to confirm these effects, there's some anecdotal evidence that it could be helpful for managing OCD symptoms. I mentioned before about your neurotransmitters being out of balance. I used to be on the highest dose of slow-release Ritalin there was. The other name for it is Concerta. It was great for motivation, but my brain was the equivalent of an engine where the RPM had been cranked up way past what it was designed for. Not only did I struggle to relax in the evening, but my sleep was affected as well. Also, at the price of being highly motivated, I became more ruthless and less empathetic. Neurochemistry sure is a complicated balance. This was my reason for starting 5-HTP, to get serotonin in balance with dopamine. And you know what? It helped. Initially, I did a serotonin selective reuptake inhibitor, or SSRI, for 6 months, but the side effects were just too many. For example, reduced libido, so instead I did 5-HTP, but a word of warning, always speak to a doctor first before coming off any medication. So what did I notice being on 5-HTP? Primarily, I noticed my sleep improved. I started on a dose of 200 milligrams around an hour before bed, and eventually built up to 400 milligrams. And then going up to 400, I really noticed the effects. The dreams while I was asleep were actually more vivid. They're easier to remember. I'm not someone who tends to remember their dreams, but at that higher dose, they were a lot more vivid. But then going to that higher dose, I'm wary of doing that long term for years on end. So I just did that for 3 months and then had a break of a month and then went back on it again. But I'll get onto dosing next. So when doing 5-HTP in the evening, I would be more likely to doze off while watching TV on the sofa. For me, who suffers from insomnia, this is a good thing. If you notice this too, one helpful tip, do all the things before bed at the same time when taking your 5-HTP, i.e. brushing your teeth, as this can wake you up again. Also, I noticed being calmer in the morning, normally being in the high stress, all systems go mindset straight after waking. So let's talk about dosages now. The typical dose for 5-HTP can vary based on a few things like why you're taking it, your health, and how sensitive you are to it. But here are a few general guidelines. For boosting mood and overall well-being, you'd usually start with 50 to 100 milligrams of 5-HTP 1 to 3 times a day. You can adjust this based on how you feel, but it's best to start with a lower effective dose. For better sleep, some folks use 5-HTP to help with sleep. A dose of 100 to 300 milligrams, 30 minutes to an hour before bed might help. Start with a low dose and see how it goes. For controlling appetite and managing weight, 5-HTP is used for this too. People often take 300 to 500 milligrams a day, split into 2 or 3 doses. But be careful with higher doses, especially for weight management. It's a good idea to speak to a healthcare professional first. You might be wondering how long it's okay to take 5-HTP, right? Well, strictly put, there's not a lot of research on long-term safety and its effectiveness of 5-HTP use. Some people use it for a while, especially for things like depression or fibromyalgia, but long-term use might lead to tolerance or dependence, and it could affect serotonin levels, so it needs watching. Some folks have used it for a year or even 2, but personally, I've done it for 3 months on and 1 month off. Now I do 2 months on and 1 month off, but that's based on how often I check my biological age. Since I struggle with sleep, I want 2 months of solid use before testing my age. Just a heads up about 5-HTP, there's a chance you might experience some of the side effects like nausea, diarrhea, and something called serotonin syndrome, especially if you're taking it with certain medications at the same time. If you notice any of these side effects, stop using it and talk to your doctor. And now let's talk about some contraindications. Be cautious with using 5-HTP because it can boost serotonin levels in your body. If you take it with other medications or substances that also increase serotonin levels like SSRIs or SNRIs or MAOIs or certain recreational drugs, you could be at risk of developing serotonin syndrome. This could cause symptoms such as agitation, confusion, rapid heart rate, high blood pressure, dilated pupils, muscle rigidity, sweating, tremors, diarrhea, and in severe cases, seizures or loss of consciousness. It's serious and needs immediate medical attention. For pregnancy or breastfeeding individuals, it's best to avoid using 5-HTP due to its limited research on its safety for the developing fetus or infant. If you have cardiovascular conditions or liver disease, be cautious with 5-HTP as it may affect heart rate, blood pressure, and liver function. If you have Parkinson's disease, talk to your healthcare provider before using 5-HTP as it may worsen your symptoms or interact with your current medications. There's certainly evidence that 5-HTP works for things like sleep, depression, and OCD, both anecdotally and in studies. I continue to use it. I have clients who use it too. I think 5-HTP has its place as a helpful supplement, as this modern world we live in of ultra-processed food and endless screen time, which tends to suppress serotonin and melatonin production through poor gut health and late night blue light exposure. I personally believe that sleep is one of the most neglected areas of health optimization across the world. If something comes up, normally sleep is the thing that is sacrificed. And I don't know about you, but if I've had a bad night's sleep, everything about the following day isn't as optimal. My anxiety goes up, while of course energy is down. Even my blood sugar is always higher. So indirectly, by taking 5-HTP and my sleep being at better quality, then I'm able to focus during the day, because if I wake up and I haven't had a good night's sleep, maybe I'm able to focus in the morning, but then later on in the afternoon, that's when my focus will really start to wane. But by taking the 5-HTP, my sleep's better, and then that's not such a problem. So maybe 5-HTP can help too. It's not a magic pill, but it can improve a lot of these common disorders I've mentioned in today's video. If you're looking to explore other things that can improve your mood and anxiety, check out this video.